Yes, so these are the important questions in Singhi Yatiraj for the chapter Anti-Cancer Drugs. So the first question is a 5-marker. The question is general common toxicities of anti-cancer drugs, cytotoxic drugs, and measures to ameliorate them. The answer which I've written is majority of cytotoxic drugs have a profound effect on rapidly multiplying cells because the most important target of action are nucleic acids and precursor. So mainly all cytotoxic drugs, they have a common action. They target rapid dividing cells because that's the most important target of action, since their job is to prevent cancer cells from proliferating. But alongside that, they show the following side effects. First, in the bone marrow, it leads to depression of bone marrow, resulting in granulocytopenia, agranulocytosis, etc., lymphoreticular tissues, lymphocytopenia, and inhibition of lymphocyte function. And 1 minute, let me put a darker thing so you people can see it as well. Bone marrow, depression of bone marrow, depression of depression of bone marrow resulting in granulocytopenia, agranulocytosis, etc., lymphoreticular tissue, lymphocytopenia, and inhibition of lymphocyte function. Example, due to lymphocytopenia, individual will be susceptible to opportunistic infections. Next, oral cavity. The oral mucosa is particularly susceptible to cytotoxic drugs, leading to stomatitis. In the GIT, diarrhea, shedding of mucosa, hemorrhages occur due to decrease in GIT. In the GIT, diarrhea, shedding of mucosa, hemorrhage occur due to decrease in the rate of renewed mucosa. In the skin, alopecia occurs due to damage to cells and hair follicles. In the gonads causes inhibition of gonadal cells, leading to oligozoospermia in males and amenorrhea in females. Fetus, teratogenic in nature, it's contraindicated in pregnant women. Secondary carcinogenicity, secondary cancers, especially leukemias, lymphoma, etc., occur due to chronic wall cytotoxic drugs. Hyperuricemia due to massive cell wall destruction, accumulation of urine. There's actually one more part to the answer, that is the measures to ameliorate them. It's quite big, so I will be explaining that at the end of the video. Come to the next question, cyclophosphamide. Next question is cyclophosphamide mechanism of action, therapeutic use, and adverse effects. It's also a 5-mark. The answer which I've written is cyclophosphamide is a non-specific alkylating agent of anti-cancer or cytotoxic drugs. Mechanism of action, these compounds produce highly reactive carbonium ions, which transfer the alkyl group to the 7th position of guanine resident DNA. This alkylation results in cross-linking of DNA strands. Therapeutic effects, it has less adverse effects compared with other alkylating agents, as it remains inactive in the liver and requires proactivation. It is quite popular in therapy to solid tumors. It is less damaging to platelets, but alopecia and cystitis are common. The adverse effects are generally cytotoxic areas, alopecia and cystitis. The next question is methotrexate, therapeutic uses and adverse effects. This is also a 5-marker. Methotrexate is a cell cycle specific anti-metabolite that is a folic acid analog. This kind of definition describes the drug from A to Z, and it gives a clear picture to the examiner. Next, it acts by inhibiting dihydrofolate reductase, hence preventing conversion of dihydrofolic acid to tetrahydrofolic acid. Tetrahydrofluoric acid is an essential coenzyme responsible for purine synthesis. Coming to the therapeutic uses of methotrexate, it is curative in choriocarcinoma, used in induction remission and maintaining in acute lymphoblastic leukemias, used in various non-Hodgkin lymphomas, breast, bladder, head, neck cancers, osteogenic sarcoma, immunosuppressant property in autoimmune diseases. Adverse effects of methotrexate. Repeated doses can cause megaloblastic anemia. High doses cause pancytopenia. Mucositis and diarrhea are common side effects. Desquamation and bleeding occur in GIT. Folinic acid is used to reverse the toxic effects. This folinic acid is important since it's a derivative of folic acid. As folic acid itself cannot reverse the toxic effect, folinic acid is used. Next, coming to zinc alkaloids. It's a three marker. Zinc alkaloids mechanism of action uses and adverse effects. Zinc alkaloids are cell cycle specific microtubule damaging agents. Mechanism of action prevent polymerization of the microtubules by binding to the beta tubulin receptor, disrupting mitotic spindle and interfering cytoskeletal elements. There are two drugs under this, vincristine and vinblastine. They are used in the remission of acute myeloid leukemia, Hodgkin lymphomas, Wilms tumor, etc. The adverse effects of zinc alkaloids. The prominent adverse effects are peripheral neuropathy and alopecia, ataxia, nerve palsies, autonomic dysfunction, and syndrome of inappropriate aldosterone hormone secretion, and also short from SIADH. Now I have concised this question for the particular mark. Well, actually, this topic is quite large. I've somehow tried to concise it in a three marker pattern instead of elaborating it too long, because it will simply waste time. Antibiotics and cancer chemotherapy is also three mark. This is as well a concise version of it. Antibiotics used in cancer chemotherapy, practically all of them, intercalate between DNA and interfere with template function. They are divided into cell cycle specific and non-specific. Cell cycle specific, you have doxorubicin, daunorubicin, and bleomycin. Non-specific is dactynomycin. Doxorubicin and daunorubicin are anthracyclines. Anthracyclines, they produce cardiotoxic. They are cardiotoxic in nature, preventing myelosuppression. Bleomycin adverse effects are pulmonary fibrosis, skin hyperpigmentation. Dactynomycin is the only non-specific anti-cancer antibiotic. The areas it causes myelosuppression, stomatitis, alopecia. These are the therapeutic uses that are generally used in the anti-cancer antibiotics. They're used in testicular tube cancer, Hodgkin lymphomas, Wilms tumor, Ewing sarcoma, rhabdomyosarcoma, solid tumors. Come to the next three marker. I have combined two three marker questions in one answer area. First question, doxorubicin. Next question is L-asparagine. Doxorubicin is a cell cycle specific anthracycline anti-cancer antibiotic. Mechanism of action, intercalates DNA, breaks in DNA. Sorry, there is error here. Breaks DNA, leads to decrease in replication. Therapeutic effect, effective in solid tumors such as breast, ovary, etc. The adverse effects of doxorubicin, cardiotoxic in nature, lead to dilated cardiomyopathy, myelosuppression. Next is L-asparagine. The mechanism of action. The L-asparagine enzyme degrades L-asparagine, which is a molecule, to L-aspartic acid, depriving them of an essential metabolite causing cell death. It is used as a regimen for inducing remission in acute lymphoblastic leukemia. Majority of adverse effects do not occur with L-asparagine, but it produces effects of defective protein levels. That is hyperglycemia, raised triglyceride levels, pancreatitis, liver defects, etc. The last three marker is thalidomide. Thalidomide, it is an immunomodulator and angiogenesis inhibitor. Let's repeat it again. The last three marker is thalidomide. It is an immunomodulator and angiogenesis inhibitor anti-cancer drug. Therapeutic uses: it has anxiolytic, antiemetic, adjuvant analgesic properties, and has been found to counteract cancer-associated cachexia. Cachexia is basically like wasting of muscle and loss of nutrition. Found effective in refractory or relapsed multiple myeloma, particularly combined with dexamethasone. Now, as I said in the beginning that the first question, one part was remaining. This is that part. Part was about chemotoxicity amelioration, right? Chemotoxicity amelioration. Amelioration means like resolving the toxic effects of the chemotoxic drugs. Toxic effects of chemotoxic drugs. So the following drugs are there. These all drugs are important for amelioration. First, amifostin. It is a free radical scavenger. It is used to cure nephrotoxicity from platinum compounds. Next is dexrazoxane. It is an ion chelator. It is used as a cardiotoxicity from anthracyclines. Leucovorin. It is a tetrahydrofluoride precursor. It is used in curing myelosuppression from methotrexate and also enhances the effect of 5-fluorouracil. Sorry, 1 minute. Next is mesna. Mesna acts by sulfhydryl compound that binds acrolein. Acrolein is a toxic metabolite of cyclophosphamide. It is used in healing of hemorrhagic cystitis from cyclophosphamide ifosfamide. Next is rasburicase. The mechanism of action is it is a recombinant uricase that catalyzes the metabolism of uric acid allantoin. It's used in tumor lysis syndrome. Next, ondansetron, granisetron. As we know, these are antibiotics. They act in 5-HT3 receptor antagonists. Prochlorperazine, metclopramide are D2 receptor antagonists. Both of them have a common clinical use: acute nausea and vomiting, usually within 1 to 2 hours after chemotherapy. Next, coming to aprepitant, fosaprepitant. They are NK1 receptor antagonists, act by providing delayed nausea and vomiting, usually 24 hours after chemotherapy. Filgrastim, sagramosin, mechanism of action: they are recombinant gram GM-CSF. I'll find out what GM-CSF will tell you guys. It is used in curing of neutropenia. Next and last drug is epoetin alpha. Mechanism of action: it is a recombinant erythropoietin used in healing of anemia. Yes, so that's it for the important Singi questions of the anti-cancer drug chapter. Hope you guys liked this video and understood how the pattern should be when writing an answer. Hope you find this video helpful, and please recommend this to your friends and fellows, and don't forget to subscribe as well. Tell me in the comments below that if you want a video like this for any other topic. I'll try my best to create that. Till then, next time, bye.